Hi, I'm Sarah. I'm one of the nurse injector and laser specialists here at the Buckingham Center.
And my name is Dr. Frey. I'm one of the facial plastic surgeons here.
Today we have a little combination case for you of non-surgical and surgical. We have this beautiful patient. She has been seeing me for about 4 years now, just with the goal to keep everything very natural and very refreshed. So her treatment plan included a combination of lasers as well as injectables. So over the years, we have done some preventative Daxxify. Actually, we've treated her forehead lines, her glabella. We do a little bit in the brow as well as a little bit in the crow's feet. We've done a little bit in the nose just for some nose slimming as well, and then a little on the upper lip for a lip flip for a little bit more fullness. We've also just done some maintenance Sculptra. We've done about 3 vials in total over the years, really just helping with some subtle volume replacement and skin and tissue supports. We've done a little Sculptra in her temple, her cheek, a tiny bit in this preauricular space, and then along the jawline just to keep everything a little bit more youthful and lifted. And then we have done some very tasteful filler. We've done a little filler in this marionette line area and along the jawline, this prejowl sulcus. We've done a little bit in her lip just to keep everything nice and hydrated as well. And then we've done a tiny bit, we call this the piriform space, along the nasolabial fold. So we have done that over the years. That's not something we did all at once. And then we did do a combination of a broadband light with a MOXI laser treatment to help with redness, with pigmentation, collagen stimulation, and overall evenness. One of her main concerns was that, we could never fully correct her forehead lines. And one of the reasons is she was just getting a little bit of heaviness. So when we were treating her forehead lines, we were always being very modest with that. And ultimately that led to more of a long-term treatment plan.
So when she came to me, her biggest concern was her upper eyelids. You can see a couple of different things. One, she's got a little bit of excess skin on her upper eyelids. But two, the other thing that I notice is she is arching her brow a little bit more in this before photo. And that's because she is trying to elevate her upper eyelid in order to keep it open and keep her eyes open. So you can see in her after photo, after we did an in-office upper eyelid blepharoplasty, we cleaned up the excess upper eyelid skin. You can already see that the curvature of her brow has come down. It's relaxed a little bit. And that's just her body naturally coming down to a more rested position, yet her eyes are nice and beautiful and open. On the next view, you can really see here over on the sides how much we cleaned up that upper eyelid skin, maintaining a completely natural looking result. So I'm really excited about that. And on the last view, again, you can see the heaviness on the side profile of her upper eyelid skin and the laxity. So a really lovely result. This is one of the combination things that we can do in our office when you combine the non-surgical treatments with the surgery. It makes the perfect pair.